Welcome, everyone. Thank you so much for joining. Please, if you're joining, let me know. Please just indicate in the chat. Thank you so much for being here. Good evening. So we are looking at breast cancer, and actually, this is breast cancer awareness month, which it is a month dedicated for our ladies so that they can know more about breast cancer and they take care of themselves and make sure that they can be fine in terms of what they should do in order to avoid breast cancer. Breast cancer, like any other cancer, is terrible, but we have to do those things that can help us prevent against breast cancer. Please, if you're just joining us, you're welcome. Thank you so much for joining. Please, can you let me know in the chat who is watching at the moment, please? If you're just joining, let me know in the chat who's watching at the moment. So, breast cancer is something that is terrible, but there are many, many ways you can do in order for you to lower your risk of breast cancer, as well as things that you can do such that you actually know if you have breast cancer. So we are going to go through some of those things. We are going to go through some of the early symptoms of breast cancer and how you can actually detect these early symptoms of breast cancer. So we are going to go through some of the ways that you can do in order to in order to know that in order to detect early symptoms of breast cancer. Please, if you're just joining us, you're welcome. Thank you so much. Please, can you indicate, let me know who's watching. Thank you so much. So the very first thing that you need to do is to do monthly self-exam. Monthly self-exam. Your monthly self-exam is very important for you to know for you to discover early symptoms of breast cancer, because when you do monthly self-exam, it actually uh, pushes you, guides you to see some of those things that you might not know that you had it until you have done this, until you have taken the monthly self-exam, you've examined your breast before you now know that, hey, come on, something was wrong somewhere and something was wrong somewhere and it needs to be corrected. So it is very important that we all try our best to do our monthly self-exams. I don't know how many ladies do their monthly self-exams. How many ladies? Please, if you're watching at the moment and you know you always do your monthly self-exam, please indicate in the chat. So what is actually monthly self-exam? Monthly self-exam is you as an individual, you do massaging of your breast such that if you see something that is not supposed to be there and it is there, you can easily report to your doctor. That's why you do monthly self-exam. So monthly self-exam is very important, it's very necessary, it's very good. It helps you to detect early breast cancer symptoms. So when you do monthly self-exams, you can actually discover that maybe you have a lump. Before, there were no lumps, but now you now have lumps, so you should get back to your doctor. If you do monthly self-exam and you realize that your nipple is somehow, maybe it is indented, it becomes inward, then you should get to your doctor. Okay, if you do monthly self-exam, you realize that maybe your left breast is now bigger than your right, because probably before you used to see that they're the same, then you get to your doctor. If you do monthly self-exam and you discover that you have nipple discharge, you get to your doctor. If you do monthly self-exam and you see anything strange within your breast, get to your doctor immediately. Call your doctor, get to your doctor, explain to your doctor. That is the best way to do. So what do you actually do? Now, a monthly self-exam is best when you have maybe you menstruate for 3 days, you give a day. It therefore means if you menstruate on the first, you menstruate on the second, you menstruate on the third. So on the fourth day, you can decide to do your monthly self-exam. I mean, every fourth day, you decide to do your monthly self-exam. That's to examine your breast to see if you've seen anything abnormal with your breast. Now, why are we saying that it's good that you do your monthly self-exam like on the fourth day of your menstruation? We are trying to avoid some type of thing, because during menstruation, maybe different things might have been happening with your breast And in terms of the sizes, maybe because of menstruation, the size of your breast is probably bigger than it should supposed to be, and you are not confused. You don't know if this is because of maybe something wrong, whereas it's just because of the menstruation. So it's good that, okay, hold on, let your menstruation, you should menstruate maybe for 2-3 days and you stop it. Now you can then continue with the massage on that 4th day. But if you menstruate, let me say, for 5 days, know that it's good that you can do the multi-self exam on the 6th day. So it's always good to do it immediately after your menstruation. But also make sure you mark that date. So the next month when you want to do another monthly self-exam, you remember that, hey, I used to do it at this time. It's good to have some specific time where you do this monthly self-exam. So monthly self-exam is the very first thing that we are talking about here, which is good that you do if you want to actually detect early breast cancer symptoms. So go for your monthly self-exam. Stand in front of the mirror. You check, you look at the sizes of your breasts. Are they equal? If, let's say, you used to do your monthly self-exam and you realize that they are equal, according to how you look at it, yes, it is true that one breast is always bigger than the other. Just like we say the left hand or the right hand is always bigger than the left hand and so on. If you look at the mirror and for you see that your left and your right breast are equal, then that's how you're going to take, because that is what your eyes are telling you at that moment. So if your left and your right are equal, then it's okay. That's what you're going to take as the normal for you. Okay, if next month you want to do your monthly self-exam to check your breast, you're touching, and first you stand in front of a mirror to look and you see that, no, this is not what I saw last month. Last month, my breasts were equal, but this month I'm seeing that one of the breasts is bigger than the other. What do you do? So you know that there's something wrong somewhere, isn't it? So since there's something wrong somewhere, you can get to your doctor such that your doctor can give you advice on that. That's the importance of monthly self-exam. So when you stand, you look at the shape. Are they equal as you used to see it? No, they are not equal. So you can report to your doctor. Now, you look at the color of the breast. Maybe it has become reddish, whereas it is not used to be like that. So what do? You report to your doctor. Okay, now you go on the massaging part where you have to check. So you have to take, now you're going in, maybe in this the order, you are just going, you're touching and you're going. Also, when you get to your nipple. Now, by touching that, if you realize that there's something harder inside, you have a harder, maybe a harder lump, right? You check that there's something hard inside. You get to your doctor. Get to your doctor and say, hey, come on, I was checking my breast. I realized that there's something harder inside. Get to your doctor. That's why you do monthly self-exam. If you check your nipple and you realize that your nipple is either maybe is getting inside, you get to your doctor as well. So that's the more reason why we do monthly self-exam, to know if something is wrong that it was not probably used to be there. Okay. After monthly self-exam, what is the next thing that you should do? Please remember that monthly self-exam is something that you have to do at home. You do it. You don't need a doctor to do monthly self-exam. You are the one doing your monthly self-exam. So you do it, stand in front of a mirror, you do that, you check the sizes, you try to massage the two breasts and to see if there's any lump inside or there's any issue with the nipple. That's the important. So you do that to check all of that. The next thing that you need to do in order to discover early symptoms of breast cancer is you need to check these lumps. So if after your monthly self-exam you discover that there was a lump, get to your doctor. So your doctor should check those lumps, because you did it yourself and you realize that there was a lump maybe on the left or the right. Okay, you now get to your doctor. Hey, come on, I saw something. I think you should check. Your doctor should check and see if that particular lump is related to anything dangerous or anything linked to breast cancer. Remember, you take note that A breast cancer lump is most likely harder, most likely not painful, most likely immovable. So three qualities. Breast cancer lump, I hope we all understand what a lump is. Maybe am I saying lump? Some people don't get it. Breast cancer lump is most likely harder, most likely not painful, most likely immovable. So breast cancer lump is most likely harder. That is, if you touch it, it looks hard. But we are not saying that all lumps that are hard are breast cancer. That's what we're saying. We say most likely. Okay, so it is most likely harder, most likely it is not moving. Which therefore means just on one spot. Okay, it's immovable. It's not like you touch and you go touch. No. It's just on one spot. It's just stiff. Okay, it's just stiff like this, just on one spot. And then most likely not painful, most likely and most likely immovable. So those are the three qualities. So when you push you further to go to your doctor. The next early symptoms of breast cancer, which we are looking at, which you will actually check, is you check for dimpled skin. Like I did mention about the nipple. Okay, if you see the nipple getting inward, so you see your nipple is folding inside, getting inward, then it's good that you get to your doctor. Okay, it's good that you get to your doctor. The next thing is you get these nipples of yours checked. Why are you checking your nipple? Checking your nipple for itching. So if you have signs of itching nipple, yeah, I have ladies who complain of itching nipple. So if you have those signs, let them be checked. Let them be checked. Another is redness. You see your nipple being red. Let them be checked. You see nipple discharge, which we have talked about, nipple discharge. So normally, if you see nipple discharge, it's good to get to your doctor. Okay, nipple discharge, yeah, just get to your doctor. Now we know with nipple discharge, is there something linked to cancerous? Has to be maybe from one nipple only, not the two nipples, and then it is also in terms of the color, it's not colorless. But no matter the type of discharge you see, okay, any discharge from your nipple, get your doctor, guys. Get your doctor. It's very important. Get to your doctor. All right. So the next thing is skin thickening. Okay, skin thickening. Thickening of the skin. If you see your nipple becomes thickened, okay, not how it used to be, get to your doctor. Get your doctor. So all of that one is under nipple texture. The next thing you check in terms to know how to get early symptoms of breast cancer is you check for pains and swelling. Yes. So pains, and if you have pains and swollen breast, let them be checked by your doctor. Yes, let them be checked by your doctor. Hi, Steph. Mama, are we here? Yes. If you have pains and swollen breast, let them be checked by your doctor. I'm okay. Well, thank you so much, Steph, for coming. How you doing? So if you have pains and swollen breast, let them be checked by your doctor, because pains and swollen breast, please, is something that could not. It's not a good thing. So if you have pains and swollen breast, please let them be checked by your doctor. Then the next thing that you need to do in order to detect early breast cancer or symptom is that you get a regular checkup. Get regular checkup. Now, this regular checkup issue is getting some ladies, I don't know, some ladies are not too comfortable for checkup, because they think maybe another person cannot examine their breast and so on, which is okay. That's patient's autonomy. But regular checkup of your breast, which therefore means maybe every after 3 months you could get to your doctor examines your breast. Okay, maybe 4 months, that's 3 times a year. All right, so it is good. Yeah, I know some people might feel a type, which is okay. It's okay. It's okay for you to feel a type, but when it concerns your health, understand that you're getting to the hospital, you're going to see your doctor because of your health. So you can always get this regular checkup, and if there is anything, your doctor will know how to advise you on that. I think we are through with our 6 important tips on how to detect early breast cancer checkup. Yeah, thank you so much. Thank you so much. Yeah, regular breast check is very important, sis. It's very important. Thank you so much for the support, Stephanie. Thank you so much for coming. So, if you have any question, please, you go on and ask a question while we now look at each of these points and we try to maybe scale through them. If you have any question, please, is there any cure for breast cancer? Certainly, cancer, as of now, cancer does not have a cure. Okay, a cure. You know that word cure medically is preferable to say treatment. Okay, treatment, complete eradication, treatment that can completely remove cancer. As of now, cancer does not have that. But normally, if you develop something within your breast and they see that it has eaten your breast, the best thing is to get rid of that breast. Okay, and excuse me, lot of ladies, the lot of ladies, when it comes to this issue of them maybe taking off their breast, they don't feel comfortable. Please, if you're a lady watching and maybe a sister of yours, friend of yours was diagnosed and they say let them cut their breast, it might be hard to accept, but understand that the earlier the better. The earlier the better. So it is always important that, please, if you have something on that breast and your doctor says that, okay, there'll be surgery where they'll need to get the breast off, it might be hard to accept that. But it is much more preferable to take this action now than later. Because if you delay and later on it has gone to the other breast or it has gone to other part of the body, it becomes so difficult for you and your family. So it's always good that you try to accept the earlier decisions when it has to do with something like this. Somebody was asking about ways to prevent breast cancer. All cancers have a similar way of preventing them. Why do they have a similar way? The reason is because cancer is abnormal growth of body cells. Cancer is abnormal growth of body cells. So which therefore means that anything that can cause you to have this abnormal growth, you stop them, it is going to prevent you from getting cancer, and in this case, breast cancer. Smoking, that is tobacco, is at the top. Is at the top in terms of what causes cancer. Oh my goodness, that your brother-in-law just died of jaw cancer. It's really painful. Sorry about that, sis. So if you're a smoker, you stop smoking, please. Stop it. For those who have been following fertility classes, my fertility classes and videos on TikTok, you see that smoking, I've talked about smoking a lot, especially when I do my live show. Smoking. If you're a smoker, you're trying to conceive, you just need to stop smoking completely. Stop it completely. It's not like you say, no, let me just take one. No. Stop it completely. So it's the same for somebody who is fighting cancer. You stop smoking. If you are a smoker and you think that you want to avoid cancer, you want to prevent cancer, you have to stop smoking completely. Completely. It's not like you start taking one stick. No, you stop it completely. Okay. Now, understand that there is passive smoking. Maybe you are not smoking, but your partner smokes. So your partner has to stop it, or you stop going beside your partner because you inhale, you're a passive smoker. And a passive is inhaling not only the smoke, but a passive smoker also inhales the breath of that person. So a passive smoker inhales the breath of that person as well. You're welcome, Sister Nancy. Thank you so much for being here. So a passive smoker also inhales not only what that person takes originally, plus that person's breath, plus that person's carbon dioxide, and so on. So it is much more dangerous as a passive smoker. So if your partner is a smoker or your friend is a smoker, right? Please, if that friend cannot stop, don't be beside that friend or your husband or your wife. Let me say your wife smokes, but you don't smoke as a man. The best thing is to stay a little bit further from him. If not, these are the major causes of breast cancer. Not only breast cancer, but cancer as a whole. Smoking, tobacco is the main cause of cancer as a whole. So if you have a smoker beside you, stay away in order to prevent cancer, and in this particular case, breast cancer. The next thing is exercises. Cancer is the abnormal growth of cells, right? So cancer is the abnormal growth of cells of the body. So if you do exercises, you rejuvenate the body. So the body always is active. It will be very difficult for these abnormal cells to grow. Okay, that's why if you look at footballers, look at the main athletes that you know, very few. In my lifetime, I've known only one athlete in my lifetime, one footballer who had a cancer. That was cancer of the liver. That was Eric Abidal, and he was operated and even came back and still played football. He's still fine now. And all of that probably because of the stringent life that footballer lives. You know, footballers, you don't just live the way you want. You have rules and so on. So exercising is very good in order to prevent cancer. Another thing is your dieting. Like we say, cancer is the abnormal growth of body cells. So dieting, if you want to diet, avoid junk food. Okay, avoid junk food. All right, please cook your nangtare. This is my meta Uma will enjoy this one now. Cook your cocoyam, your plantain. Okay, for those who can get that. Okay, if you can get rice, good. Avoid getting all of this canned food. All right, all of this canned food, the fried stuffs, all of this fried stuff. Please avoid it. Because if you eat your cooked food, this will all prevent you from getting cancer. Not only cancer you preventing when you eat balanced diet. Obviously, you're getting yourself healthy, and many other cells of the body will be fine because you're eating a balanced diet. So for you to prevent breast cancer like any other cancer, eat balanced diet. Especially take lots of fruits and vegetables. For those who have been following fertility class again, you must have realized that I've talked about vegetables and fruits. Yeah. So you see that vegetables and fruits here, when you take them on, it helps you for cancer. It helps you to avoid cancer. And in this particular case, we are talking about breast cancer. Okay. Another thing. Yeah, where are my ladies? Where are the mothers? Where are the mothers? This is beautiful. Another point here, please, if you're a mom, can you just say hi in the chat? If you're a mom, can you just say hi in the chat? Another thing is when you breastfeed your baby. Breastfeeding your baby has been shown to greatly reduce the risk of breast cancer. Is that not beautiful? So God is giving you double blessing. You're giving your child food, at the same time you're preventing yourself against cancer. Is that not wonderful? Is that not wonderful? And breastfeeding alone does not only prevent, but breastfeeding does not prevent only breast cancer. Hi, Sister Monica, you're welcome. Thank you so much. Breastfeeding does not prevent only breast cancer, because it also prevents other things as well. So, is that not beautiful for you to breastfeed your child? So, breastfeeding is another important thing if you are trying to prevent breast cancer. Breastfeed. Please, let me say this. Let me say this because I know people here breastfeed, and to my guys, I don't know how many men are watching at the moment. So my guys out there, they might be thinking, oh, therefore me, I can also breastfeed on her breast. Okay. And you will not be breastfeeding, you'll be sucking. Those are two different things. So breastfeeding and you just sucking the breast with nothing coming out, these are two different things. So if you get on the internet, you will see maybe articles telling you that when a man sucks, it prevents breast cancer. No, these are two different things, please. God is so wise and great. So to prevent breast cancer, breastfeeding your child prevents you from, it reduces your risk of breast cancer. Please, it does not prevent, it's not like prevention. It reduces your risk of breast cancer. But if your partner sucks, it does not have that same effect. Please, these are two different things. Your child is feeding on your breast. Your partner does not feed on that breast. Okay, your partner does not feed on your breast, but your partner actually just mingles around the breast, which is not feeding. That's why it will be very difficult for your partner to suck your breast when you are actually lactation. When there's lactation, okay, when your breast is actually flowing, he will not touch it. He'll avoid your breast at that time, isn't it? So there's a difference when your partner sucks on your breast and your child feeds on the breast. So these are two different things. So for the fact that your child feeds on the breast, it's an added advantage. Not you are helping your child in terms of the natural milk you give your child. At the same time, you're preventing yourself. You're reducing your risk of having breast cancer. Is that not beautiful? Is that not wonderful? But now let me say something. Maybe it's an advantage now to my men out there. For the fact that your man has to do that sucking, okay, he's sucking your breast, is also a way that can help you in terms of breast cancer. Why is it a way? We are not saying that it helps, it prevents breast cancer. When he sucks and something is wrong with that breast, he will tell you easily. It's true, right? Let me say, yesterday, he sucks and there was no breast milk coming out from it, or there was no liquid from the nipple. Okay, but today now he wants to suck the breast and he realized that there is water, maybe something tasty like salt coming out from your nipple. He will tell you. He'll tell you that there's something wrong. He'll tell you that there's something wrong. So that's why there is the advantage that way. So he will be able to tell you if maybe something's wrong, or maybe by touching, he might find some other thing wrong, not only in terms of the nipple discharge. He might realize that maybe there is some sort of a lump somewhere where you haven't realized that. So a child breastfeeding on your breast reduces your risk of breast cancer. A man that sucks does not reduce the risk, but the man can help you pick out some of the risk. Okay, the man that sucks your breast can help you pick out some of the risks of breast cancer. I think with that, you will see that we have actually exhausted a lot of ways that you can prevent breast cancer. Please, is there any other question? Thank you so much, Sister Stephanie, for being here. Sister Monica, I really want to appreciate all of you for being here. I really want to appreciate all of you for being here. Sister Monica, thank you so much for being here. Stephanie, thank you so much for being here. Please, is there any other question, please? If no question, I want to appreciate you people all for being here, for all those who are trying to be here. Please, if you can share this video to one or two persons, it will greatly help someone somewhere. I really do appreciate. For those who are following me on TikTok, I'll be live very soon. And for TikTok, it will be a very long night for us. We're going to discuss all of this in details. So I want to appreciate. I wanted this one to be up here on YouTube so that people can also follow. So thank you all for being here. May God bless you. Do have a wonderful time. I've been Tima Dauda. Thank you.